Hi everyone, I want to talk about systemic inflammatory response syndrome, non-infectious causes. In other words, there are so many infectious causes of systemic inflammatory response syndrome. Then why is this very important? Let's go. If you have gone through my channel and if you have listened to two of my presentations, one on sepsis, sepsis 1, and the other one still on sepsis, sepsis 2, I have straightened some stuff out while defining some times when it comes to sepsis, the stages going to shock. And I said that sepsis was in the past having some stages that included sepsis. And sepsis was defined as systemic inflammatory response syndrome plus infection. I said that it is no longer included because it is not always caused by infection, which means SIRS is not always caused by infection. You can check sepsis 1 and 2 on my channel to find out. Okay, if SIRS is not always caused by infection, then what else? Let's go. Okay, the non-infectious causes of systemic inflammatory response syndromes are pancreatitis. Pancreatitis may be secondary to gallstone or secondary to hypertriglyceridemia or secondary to autoimmune could cause SIRS. Burns, hypoperfusion caused by trauma. And I don't need to say that you know that is going to be secondary to massive blood loss, right? Hemorrhage, crush injury, blunt trauma with internal bleeding, right? Amniotic fluid embolism in pregnant women, air embolism from puncture, anyhow, right? Fat embolism, that is trauma and fracture of the bones, particularly long bones, right? Idiopathic systemic capillary leak syndrome. And of course, when there's cardiac arrest and there's return of spontaneous circulation, you are likely going to see systemic inflammatory response syndrome. Also, SIRS could be found in overdose of certain medications and even street drugs. How about pulmonary embolism? Yes, systemic inflammatory response syndrome is possible with pulmonary embolism. The same could be said when it comes to anaphylaxis. What are the possible complications? Please listen to the presentation that I published on sepsis 1 and sepsis 2. The end result will be shock, hypoperfusion, leading to renal failure, liver failure, heart failure, and multiple organ dysfunction syndrome. It's great to check for infectious sources, but you may not find one. So if we're done and you are still having signs and symptoms of systemic inflammatory response syndrome, then check these causes that I've just listed. With that, I've come to the end of this very presentation. Kindly subscribe to my channel, particularly go through sepsis 1, sepsis 2 for this purpose. Thank you.